touches. So this down around the neckline. Hi Lucy.
Hi.
How's it going?
Good, how are you?
I'm doing well, thank you. Welcome to the clinic.
Thank you.
Appreciate you for coming in today. I know you're a volunteer, so we really appreciate your time. Now, just to go ahead and jump in, obviously you are here for our clinical trial today. So are you aware of the terms of the examination today?
Yes.
Okay. So just to reaffirm everything, you're here for our clinical trial because you've been experiencing headaches, and it looks like phase 1 of the trial did not work for you. So we're going to go ahead and move on to phase 2, which is our series of physical tests. Now, for phase 1, we had you watch ASMR simulations, and it looks like you did have a little bit of relief, but not quite as much as we would have hoped. So moving into phase 2, I will be performing the simulations on you in person, and we're going to kind of get a better gauge if any of these examinations actually work for you.
Perfect.
Okay?
Thank you.
So several experiments that we will be working with today, mostly geared towards medical ASMR simulations.
Perfect.
Okay, all right. Now I do want to just go ahead and get you checked in for the trial. So, of course, if you can just confirm your name for me.
Lucy.
Lucy, very good. And if you could give me your 4-digit trial PIN.
2464.
2464, perfect. Here you are, have you pulled up? Okay, all right. Well, let's go ahead and jump in. I have quite a few things that I will be testing today. Now, for the purposes of the trial, of course, I will be referring to these simulations as triggers. After each trigger is applied, we will have you rate whether or not you're feeling any relief from your headache on a scale of either 1 to 5 or 1 to 10. And at the end, I will ask you if there's any that you would like to reassess.
Perfect.
Okay?
Thank you.
So obviously it's best that you are honest. If you feel that none of the stimuli work for you, if you feel like none of the triggers provide you any headache relief, that's perfectly fine. We'll just test a couple different things upon your next phase.
Perfect.
Okay? All right. Okay, so let's go ahead and get started. Okay. So the first trigger is going to function like a basic visual inspection. So oftentimes when you go to the doctor, they perform an inspection and just kind of have a look over to see how you're doing. That's what I'm going to be doing. So each trigger time will vary. I'll try to keep them between 1 and 2 minutes each.
Okay.
Okay? So I'd like you to just act as if you are actually at the doctor. That way we can get the most accurate reading.
Okay.
Okay? All right. All right, Lucy. So going in with my pen light, the light is a little bit bright. So I'd like you to look directly at my face. Try not to focus directly on the light just yet, okay?
Perfect.
Okay. So just going to start by having a once over here. So just performing an overall visual inspection. So having a look at your skin. Just overall look at your hair. Posture is good. Sitting upright. Shoulder alignment appears equal. Not noting any signs of distension at the clavicle. Overall skin texture is very even and clear. No signs of abnormality there. And quickly down your face. I'm not noting any abnormality there. So I'm just going to have a look at your arms in proportion to your torso. It's very even bilaterally there. Legs as well. Good. Okay. So nothing overtly concerning externally as far as I can tell. So that's very good. Alright, so that will conclude trigger number 1, which was our visual inspection. Now if I could have you tell me on a scale of 1 to 10, 1 being didn't make much of a difference to your headache at all, I would say 5 would be maybe mild to mid-severe relief, and then 10 would be you feel no headache at all.
I would rate it maybe a 4.
A 4, okay. So little bit of relief, but you're definitely still feeling the effects of your headache. Alright, so that is very helpful. We can go ahead and move on to trigger number 2. I'm going to be performing some manual palpations. So just as you would have it with your regular doctor, where they kind of palpate around, manipulate you with their hands, feel around for any abnormalities, I'll be doing the same.
Thank you so
Okay?
much. Perfect.
So I'd like to assure you that my hands are clean. So do I have your consent to touch your face today?
Yes.
Okay. So I'm just going to move you around here slightly. So just turning your face so that I can have a look. So just having a look at the hairline here. Good. Not noting any signs of abnormality there. Having a look at the eyebrows. As well as the overall bone structure. Just going to gently palpate along the ears here. I do feel a slight temperature variation there. Your ears are just a little cold. Just going to feel down the neck and clavicle area. Just looking for any signs of swelling here along the chain of nodes. Peek under the necklaces as well. Look at the skin. This side as well. Not noting any abnormality there. Okay, so just palpating along the jawline here. Very gently under the eyes. Okay, so I'm just going to have a look at your hands as well. So just following down, looking at the nail beds. Beautiful jewelry.
Thank you so much.
Of course. Okay, so just having a look at your arms as well. No signs of discoloration there. Okay, so I'm going to have a look at the other side as well. Good to no abnormality at the palm. And the wrist are okay. Alright. Okay, you can go ahead and relax for me. Now that concludes our second trigger, which was our palpatory assessment. And if I could have you rate that on a scale of 1 to 10 for me.
I would say that was a 6.
A 6, okay. Slightly more relief there. Now, because you got a higher score for your second trigger, I would just like to ask a follow-up question. Would you say there was anything notable about the second trigger that gave you the higher rating? Was it the physical aspect or the personal attention aspect, or what exactly would you say made it go from a 4 to a 6?
I think it was both of those things.
Okay.
I really enjoyed the soft touch,
Okay.
and it really calmed me down and alleviated any kind of stress I was feeling. Like, I really enjoyed it.
Very good feedback. Thank you very much. So definitely will incorporate soft touch as we move forward. Okay. So let's go ahead and move on to trigger number 3. Now, trigger number 3 is going to be another hands-on assessment. So I'm going to move into one of our tools here, and this is actually a tool that we would use in acupressure, but for the purposes of today's examination, I'm going to be using it to simulate a test for swelling and edema. So something you would do with like an endocrinologist, maybe during like a diabetic exam, or even with your cardiologist if you were experiencing an excess of fluid. They would test to see how much fluid you are retaining. So just to give you an example, I'm going to be applying a very gentle pressure over your face as well as your chest and arms. And I'd like you to just react normally. Let me know if you feel any pain or discomfort, and at the end we will assess.
Okay, perfect.
It is a little bit cold, just to give you a warning.
Thank you.
So I'm going to start here near the ear. So very mild pressure here. And this can feel comforting to some. It does act as a bit of pressure point therapy, so I do try to place it fairly strategically. So you have pressure points along your ear that tend to relieve headaches, which is why some people get a piercing here if they have chronic migraines. So just checking for swelling. I'm going to carry that down the neckline here. Very good. So far, no notable signs of swelling or edema anywhere here along the chest wall. Also just going to test that here along the mandibular joint. So nothing notable there. Good. The top of the cranium here. And if I could see your hands, Lucy, just going to test for any swelling here. Okay. Okay. All right, you can go ahead and relax for me. Okay, now, as far as our tests for ruling out any signs of edema, did you get any relief from that? What would you rate it on a scale of 1 to 10?
I would say a 3. I enjoyed it more on my neck area.
Got it. Okay, so more relief when we did it around your neck. Okay. So definitely something to note there. Okay, all right. So let's go ahead and move on to our fourth trigger. Okay. So we have a couple different things we can test, and why don't we go ahead and I'm going to use the same tool, but we're going to use it in a different way. Okay. So this time I'm going to do a bit of tracing, and why don't we focus specifically on the clavicle neck area since you saw some relief there. So using the same tool, this time I will use both sides, and instead of using it to apply pressure, I'm just going to use it to gently trace along the bony prominences, so your collarbone, your shoulder, scapula area, following down the chest wall, and then up along the mandibular joint as well as around the ears. See how we fare with that, okay?
Perfect.
All right. So I'm going to work from top to bottom here. So we'll start here around the hairline. Just gently tracing. Around the ears as well. And down the clavicle. And I'm just going to test underneath your jewelry here as well, if that's okay. So I'm just gonna have you turn towards me, and we'll follow that along the other side as well. So always want to test bilaterally. Okay, so we'll return to midline there. And I'm going to follow that down the shoulder, as well as down the arm. I'll just take your hand here, so just go ahead and relax the weight of your arm for me. Just tracing up the hand. Alright. And testing up the clavicle as well to overlap any. Alright, this is doing okay so far. So that was trigger number 4. Carry that down to the
How
would you say that did?
I would rate that a 7.
A 7, okay. So definitely getting somewhere there. Okay. Now, obviously the last test used the same tool, just in a different manner, but we got a very different rating. So, would you say it was the change of pace? This was much slower, kind of softer. Was it a combination of things? Was it the location of the stimuli? Where would you say the difference lies for you?
I think it was the softness.
The soft. Alright, so definitely we'll keep that in mind as we move on. So our next trigger is number 5, so we're about halfway done. So moving right along. I'm going to do something a little different. So I'm going to do what's called an anticipatory trigger test. So this is going to act as somewhat of a hearing test, but it's going to be a little bit unexpected. So I'd like you to close your eyes, and I'm going to make a sound with my pen, just like this. And I'd like you to just indicate on which side you hear it. Now the difference here comes in that I want it to be a bit unexpected, so there might be a long pause in between one sound to the next. You just do your best to isolate where the sound is coming from. Okay?
Okay.
All right.
Left. Left. Right. Left.
one was a little bit different, so that was our anticipatory sounds. And we'll do a scale of 1 to 5. 1 being mild to no relief, 5 being pretty decent relief. What would you say?
I would say that was a 2.
A 2, okay. So a little less effective with the sound triggers there, so that's very good to note. Okay, so slightly less effective. All right, Miss Lucy, well, you are doing really well.
Thank you.
So we can go ahead and move on to trigger number 7. We've got about 4 left, okay?
Perfect.
So we're doing really well on time. Okay. Let's go ahead and move on. I think the next one I would like to do is a bit of a classic with the ASMR community. So obviously you are familiar with the content.
Yes.
I would like to perform what's known as a sharp or dull examination on you. So
Perfect.
essentially going to apply a couple different kind of tactile sensation, varied mostly on your face and neck area, a little bit on the upper extremity as well. Okay?
Perfect.
So I have a couple different things that we will test this with. I'm going to start with just the very basic sharp or dull.
Okay.
So for our dull sensation, I have just a regular cotton wisp here, just very soft sensation. And then for our sharp, I have a variety. So I have just a wooden applicator here, as well as our classic Wartenberg wheel, which is obviously very sharp. Okay? So I'm going to start with just the soft. If I could ask you to close your eyes for me, just let me know when you feel it, okay? So you can indicate however you're comfortable, either shake your head or verbalize, yes, you feel it. Very good. Just gonna test underneath here. Very good. Very good. So now I'm going to vary between the sharp and the dull. You don't have to respond verbally. I would again just like you to let me know if you feel it, okay? Very good. Very good. That does conclude trigger number 7. Now that one was quite lengthy because we did test a multitude of stimuli there. So, if I could have you rate it as a whole, how would you say the experience affected your headache?
I would say a 5.
A 5, okay, so about mid-range. Okay. Was there any part of it in particular that you feel was helpful or unhelpful?
Yes, it was near my forehead.
Okay, so forehead area was definitely helpful. And that is in line with that eye pain there, so that makes sense. Okay. Did you have a preference at all between either the soft sensation or the sharp sensation?
Soft.
The soft, okay. Very good. Alright, thank you very much.
Thank you.
You can go ahead and move on to trigger number 8.
Perfect.
Moving right along, we have about 3 left. Okay, so this next one is going to be I'd like to perform some percussion. Now I have a very small reflex hammer here, and you might have this examination done with your general practitioner or maybe an orthopedist, where they just kind of percuss along bony prominences, just very gentle manipulation. So I will be doing this either using my finger as a buffer or just using the hammer itself in these smaller areas. And I'd like you to just close your eyes for me, and of course just let me know if any of this helps at all, okay? So I'm going to start lower down this time. So I'm going to start down kind of at the wrist and hand area, and then we're going to work our way up. So percussing along these areas. Gentle percussion at the inner elbow area, and then of course along the shoulder. And a little more gentle along the clavicle. And very mild percussion along the brow bone. And lastly, just a gentle percussion here along the forehead hairline areas. Okay. All right. Now that last one was a little more on the clinical side. So how would you say that affected your headache, if at all?
I think maybe a 4.
A 4, okay. So not quite as strong as the others. Similar to the last, was it more relieving around the eye area, or was it about the same everywhere?
It was more relieving around the eye.
So more relieving around the eye area.
Yeah, and also when you were kind of near the hair.
Near the hair. Okay, so definitely around forehead hairline area. Okay, that actually works in line with our next 2 triggers because they will be involving your hair and hairline area, so that's very good. All right, so let's go ahead and move on to our second to last.
Perfect.
Okay. So for our ninth trigger, I want to do something a little more involving the hair itself. Okay? So I'm going to be using my comb to simulate a bit of a scalp exam. So just going to be poking around a bit, specifically at the hairline area, doing some sweeping motions of the hair. Again, I'd like you to just close your eyes and let me know if any of this triggers you in a particular way. So I'm going to start with you facing me, and then for our 10th trigger, I'll have you turn away from me.
Okay, perfect.
So I am going to come just a little bit closer, excuse me. Alright, so you just close your eyes for me and rest comfortably. And of course, down at the nape of the neck as well. Back along the hairline area. Okay, so I'm not noting any visible abnormalities there. Okay. Very good. So that was our ninth trigger. And a couple different things there. I did a variety with the comb as well as with my hands. So some combing motions as well as just some gentle sweeping motions. So overall, how would you rate that trigger as a whole?
I would rate it an 8.
An 8. Okay, so we did very well with that one.
I really enjoyed the gentle sweeping.
Okay, so really like the sweeping motions.
And like near the nape of the neck.
Okay, very good. So the follow-up test will be more back of the head, nape of the neck, so we can definitely follow up on that. So that's very good to note. Okay. So far it looks like we're favoring the kind of softer, more tactile sensation, softer touches. So it's very good. All right. Let's go ahead and move on to our final test, shall we?
Yes, we shall.
Okay. Does that feel okay?
Yeah, perfect.
Okay. Just gonna adjust your shirt here.
Thank you so much.
Of course. Okay. All right. So we're gonna go ahead and begin with our 10th and final trigger. And for this one, I'm going to be incorporating a couple different things. So keeping in line our notes from before, you did say that you found some relief from the soft touch at the nape of the neck. So I'm going to begin by incorporating that here. Some very mild touches. So this down around the neckline. Having a look at the hair itself. So I'm just going to go ahead and remove the hair clip. Your hair is quite lovely.
Thank you so much.
Just going to have a look at the hair itself as well as do a brief once over of the scalp. overall the hair does appear quite healthy. Not noting any signs of particular abnormality here. Very well nourished, well moisturized. Of course, having a look at the surrounding areas as well. And just doing some overall manipulation. Now, I'm going to just have you turn your head slightly for me here. Just going to clip away a few areas. Have a peek at the surrounding areas. Just looking at the shoulder. Go ahead and remove our clips. And of course, return your hair to its original style. All right, Miss Lucy. If I could have you return to a front-seated position for me.
Of course.
Okay. So that concludes our 10th and final trigger. And on a scale of 1 to 10, how would you say as far as headache relief? Did that affect you at all?
I would say that was actually a 10.
Really? Okay, so you did very well with that one. Is there any specific feedback you'd like to give?
I really loved the clips.
The clips.
And I think the hair being in different areas was really helpful for my headache. I think I carry a lot of tension.
Okay, so that makes sense. You do have a lot of hair, so it is very heavy can, if you wear it in the same style, it can tend to pull. So that definitely makes sense. And then definitely played into the tactile sensation that you enjoy. So that is very good. The left side here. Alright. So let me just go back to our preliminary assessment here. Now, at the start of our examination, you did say that you had quite a bit of a headache. It was about mildly severe. You rated it a 6. If I could have you re-rate your overall headache for me, what would you say it is now?
Honestly, I think it's now about a 2.
A 2. Okay. So it did make quite a significant difference there. Alright, just put a 2 out of 10. Very good. Okay. So still not quite at a 0, but obviously making progress.
Yeah.
So I would like to have you back in for phase 3 of our testing so we can complete our clinical trial. Now phase 3 is going to incorporate all of the positive reactions that we got from today's testing. So I will begin inputting this into our database. The algorithm will come up with your phase 3 examination, which will be accumulation of all of the things you said benefited you from today. So when we have you come in for phase 3, it will only be testing the triggers that you said were helpful for you, and we'll kind of narrow down and hopefully get you to a 1 to a 0 out of 10.
Perfect. Thank you so much.
Of course, we appreciate your time, and obviously our volunteers are very busy, so we thank you very much for coming in. And if you could head to the front desk, I would like the receptionist to go ahead and get you scheduled for phase 3. That way we can get you started.
Okay, perfect.
Okay?
See you soon.
All right. Well, thank you very much. I'm going to go ahead and get this started, and I will see you next time.
See you next time.